500 North 3rd Street and All Organic Medical Marijuana. I'm interviewing Dr. Roman. Dr. Roman, why don't you tell us about yourself?
Sure, Pete. I'm Matthew Roman. I'm a medical marijuana physician. A little background about myself. I was born in Vienna, Austria. My parents were escaping communism from Poland. They moved when I was a baby to Idaho, Boise, Idaho, to the desert land there. And eventually they made it to Philadelphia, where I was raised. And I later studied neuroscience at Franklin and Marshall College before going back to Poland, where my family's from, for medical school. There I learned a socialized healthcare system and came back here to train at UPMC Mercy Hospital to see our own healthcare system and how well it functions. Later I became a hospitalist, which is somebody who does all the major long-term work within the hospital care for a patient. So, for example, when an ER physician needs a little extra help and a patient's got to go upstairs, that's where I come in and they sign out to me. I learned all of the body that way, had a lot of various different conditions I had to know and manage. And by that stage, I had started to become very interested in medical marijuana and cannabis, researching it in depth. And I eventually started a medical marijuana clinic in Wilmington, Delaware, where it had already been medically legalized, before in 2016 opening up a second clinic for patients in Philadelphia, those who are residents of Pennsylvania. So now I've got both of those clinics open, and I'm seeing patients from both states, and I've been seeing tremendous results.
Okay, great. So, question, why did you decide to not just be a primary health physician or a family doctor and decide to also help people with medical marijuana?
Well, after studying in Poland, I saw the differences in healthcare systems between what we have here in America and what they had there. And I saw a lot of opportunity for cannabis to serve as an answer to some of the problems we're having here in the States, here in our healthcare system. Those being specifically, some of the big ones are the opiate pandemic that's occurring here in America. We use the most pain meds of any country, and we're hooked. And cannabis can serve not as a gateway drug, the way they always kind of taught us growing up. This is a gateway out of that problem right there. It also just serves as a great medicine for a lot of the polypharmacy problem, which is, I know that's kind of a technical term there. That means that we give too many medications to people, and sometimes doctors are just throwing a new one and adding them on, and we forget to take them off. And a lot of times I see patients with a long list of meds, and we can cut that down to the more efficient ones, the ones they really need, alongside with cannabis, which can take over multiple functions, and that includes many of the drugs. So, that's kind of that.
Okay, great. So what do you look at the future as far as medical marijuana and your practice? What do you see happening in the near future?
I have a lot of hope for the cancer development of cancer medications. If we could find strains that work well for certain cancers, and if we can do more research in that, we would be saving a lot of lives, alongside helping their side effects of any chemotherapy or traditional medications that they may be on. And besides strains, we could potentially, down the line, even develop new medicines that are a bit pharmaceutical, where we isolate a certain cannabinoid and target particular receptors or genes in order to treat conditions that don't have answers right now. And so I have a lot of hope in the oncology field, the cancer industry. when it comes to cannabis.
Okay, yeah, that sounds good. Is there anything else you think you'd like to add?
Yeah, I'd like to reach out to other doctors out there, and I'd like to ask you to be more open to this, because we are causing a lot of harm also to our public and to our patients, and some of that is the medication for pain with the opiates, the oxycodone, the codeine, but also the over medicating, and we're sort of losing the close relationship we used to have in traditional healthcare, the traditional patient-physician relationship. And if you don't know a lot about cannabis, it may be hard to breach that subject with a patient, especially if they start talking about it to you unexpectedly. But you can send them to physicians like myself to talk in more detail about that subject, and I'd be happy to help. In fact, I recommend that to any physicians that could use that sort of help. And also, you can look into it by reading my blog, where I discuss a lot of topics from a medical standpoint concerning cannabis, including interactions with drugs, etc. And also, subscribe to my newsletter. I only send one out each month, and it's got great content. I spend a lot of time on it, so I recommend that not only to doctors, but to everybody out there.
Okay, that sounds good. And as far as Pennsylvania, because I'm from Pennsylvania, how far along is the legalization process for patients to get their recommendation cards from someone like yourself?
Pennsylvania has approved dispensaries and growing facilities already, so we already know who's going to be having those opening up. They have a 6-month deadline, according to the bill that's been passed, to be operational, which means that they should be operational sometime around January or so. At that time, patients should be ready with medical marijuana cards so that they can enter the dispensaries alongside their PA identification cards or driver's licenses and purchase the products they need to medicate themselves. Right now, already I, myself, and other physicians can register online on the Department of Health website, and they can also submit their training. They need to do 4 hours. I was actually the first one in Pennsylvania to submit their training to the state, they told me. And but the patient side of it's not open. And the next step is for patients to go online and create a username and password so they can log in to the same website, the Pennsylvania Department of Health website for the medical marijuana program. You can choose from a list of doctors who you've seen, and I suspect they'll link us up somehow and eventually send you your medical marijuana cards. That should be available for when the dispensaries are open, hopefully in January sometime.
Okay, great. Pete Gustis here with 500 North 3rd Street and All Organic Medical Marijuana, speaking with Dr. Roman. Thanks for your time.
Check out natureswaymedicine.com.